So our big idea is really a simple one. We want to help caregivers. Rosalind Carter, a renowned expert in caregiving, said that there are really only 4 kinds of people in this world. And this is your first audience participation portion of the night. So let's see how we fit into these categories. Raise your hand as I talk about these and when it applies to you, and keep them up until the end. So the first is those who have been caregivers. I wish I could say I could see you, but I can't. Those who are currently caregivers. Those who will be caregivers. I hear more hands going up. Those who will need caregivers. So the act of caregiving really does touch all of us. This is a big room, and that's a lot of hands that were up in the air. So the issue is that as more and more Americans are called to give care, we must provide the right supports to allow them to do their job. Unfortunately, most people do not know how to be a caregiver.
I began as a caregiver 13 years ago when my husband suffered a severe stroke which left him unable to walk and unable to use his left hand or his left arm. When he first came home from the hospital, he couldn't do any of the activities of daily living. I felt like I was alone, and I had no medical training.
As a manager of the community care team, I oversee our community health nurses and community health workers who are often working with caregivers.
Since that time, I've interfaced with a lot of caregivers who along the way I've learned that their caregiving journey also started quite unexpectedly with no time to prepare.
Well, it happens quite often that some of our patients will leave the hospital and then return. And a lot of times it's because their caregiver doesn't have the skills that they need to care for their loved ones at home.
The last thing my son needed was to have 2 sick parents to take care of.
The big idea is going to provide targeted skills training to caregivers for free via an online module that they can access 24 hours a day, 7 days a week.
Our goal is to empower caregivers to care for their loved ones at home safely, whether it is preventing them from falling, whether it is transferring them from bed to a wheelchair. We are going to provide all of these skills through Howard County experts, resources, services, so that when our caregivers watch these videos and learn from them, they will have the resources and the go-tos to follow up with.
You will not believe how much knowledge and how much confidence you'll have once you take that course.
This Practical Skills for Caregivers course originated as a 15-hour course over 5 weeks. It's a huge commitment for caregivers. So our big idea is to have these sessions online for them so it's accessible, it's at their fingertips.
They don't have to attend a series of courses. They can really hone on the skill set that they need and really just get what they need when they need it. This course ultimately could help us to reduce hospitalizations for our clients that return to the hospital quite frequently and improve their health overall. And I really think that's what it's all about.
This big idea is going to affect so many people. It's going to make the difference between their loved ones going to an assisted living or a nursing home or staying at home where they want to be.
So this was a collaborative effort of many organizations in the county. All were actively participating, and many of them are here tonight, I think over in that segment of the room over there. We're going to build upon their momentum in aggressively marketing this effort and providing engagement. In terms of the rest of the plan, we would use Changemaker funds to actually work with a nurse educator to refine the course content and build online modules with an instructional designer. Then those modules will be made available through the hospital's website as well as the Office on Aging and the Maryland Commission on Caregiving. We will also monitor feedback and change the content as needed to adapt to caregivers' changing needs. And because of the Changemaker funds, we will be able to make these classes free and offer them at no cost. Our society really has not done a very good job taking care of caregivers, and I think it's time for us to change that. If you think about all of the hands that were raised earlier in the presentation in terms of the type of caregiver you will need or will be, we are all like Claire and Jerry. I think it's time, we think it's time, to help. And so with these Changemaker funds, we're going to be able to do just that. Practical skills, this course will be able to provide support and the right tools for caregivers and their loved ones. Let's get on it, let's get to it, and let's help everyone who will be called to care both today, tomorrow, and in the future. Thank you.